All right, everybody, it looks like we've got 4 people on right now. I'm gonna go ahead and play a video right now, just while we're waiting for people just to filter through. So I'll introduce everybody and introduce myself here in just a moment, but if you'll just bear with us for another minute or two while we have some late joiners coming on. So again, I'll play this video here and be back on with you shortly. And Aaron, do you hear sound? I know Dr. Trott just said that there was no sound on this.
No, I do not hear sound. If you want to go back and reshare the slides, you might want to just double check that you have that box checked that says share computer sound.
Planted in the body with 3 small incisions in a same-day outpatient procedure. After the procedure, Mike works with his doctor to fine-tune his Inspire. Once it's fine-tuned, Mike simply clicks the remote to turn on Inspire and goes down to sleep. While Mike is asleep, Inspire monitors his breathing. Every time he takes a breath, a gentle pulse moves the tongue out of the way and keeps Mike breathing freely. And more importantly, sleeping soundly, the way he used to. This has been a total game changer for Mike. Mike is getting more out of life and back to being his old self again. No mask, no hose, just sleep. This is Mike.
One day, I just happened to go online and see this ad about Inspire, and I thought, oh my gosh, I need to look into this. Maybe this is the answer.
I was like, wow, look at this. And so I immediately went online and I read all about it. I called up that day and made an appointment.
The more I read, the more excited I got. And instead of feeling defeated, I felt hope that there was something there that was actually going to work.
I was inspired to hear that there was something other than the CPAP machine and the oral appliance, because those were the only 2 options that I knew of.
I had tried all these other things, and I was at a point of, I don't know what I'm going to do.
I felt like I had been in pain for years, living with a CPAP, with a dry mouth, with it irritating my skin. I just thought, this is the end all. I'm totally excited about it. I want to get it. Life is going to be fantastic. I had no doubts.
I had no apprehensions. I knew it was a new product and everything, but I knew what I had been dealing with over this period of time. To me, it was not really much of a risk. It was just something that I needed to try for myself, to try to get some peace of mind and some more rest.
Once I met the Inspire team, they helped me with my insurance. They were behind me 100%, as my doctor was. My family was extremely supportive.
I got in touch with Amy from Inspire, who reached out. The way she talked to me, the questions she asked, you could feel she had a passion for it. It made me feel good that, okay, here's somebody who's really on this. She believes in it. I would highly recommend contacting anybody at Inspire. If you've got any questions, if you're unsure about something, just talking to somebody about the experience or what they could go through, or just to get those answers, is well worth it.
All right, so it looks like we've got 22 people on right now, so I think we'll go ahead and get started. So hi everybody, my name is Matt Douthit. I am the rep for Colorado and Wyoming, or one of the reps. I'll be facilitating this, but I do want to take a second and just introduce our panel here today. So we have Dr. Marty Trott. He grew up in Buffalo, New York. He received his undergraduate and medical degrees from University of Rochester. and trained at the Cleveland Clinic. In 2010, he received his Master of Medical Management degree from Carnegie Mellon University and is the medical director for St. John's Health Physician Practices. We're also joined by Dr. Haven Malish. He also works with St. John's Health. He's board certified in sleep medicine and pulmonary disease. Dr. Malish completed fellowships in pulmonary and critical care at the University of Southern California and in sleep medicine at the Mayo School of Graduate Medicine Education. And the third person on here, we have Shawna Giles. She's a nurse practitioner. She conducts sleep consults and follow-up visits. She holds a bachelor's degree in nursing science and from the University of Pittsburgh, and a master's degree in nursing from the University of South Florida. So that's our panel for this evening. Just a quick housekeeping note, the meeting is being recorded just for future use. We will go ahead and take some Q&A at the end as well. The way to do that is that there's a Q&A button just at the top of your screen if you hover over. Please understand that I can't open the Q&A actually during the presentation, but there is a Q&A period after the panelists speak. So at this point, I'm going to go ahead and turn it over to, I believe it's Shawna is going to lead us off. Is that correct, Shawna?
Let's let Dr. Malish take a crack at this once he unmutes.
Yeah, I think it's usually me that does this. So, so I'm going to start off with what exactly obstructive sleep apnea is. Can everyone hear me? Okay, good. And so we have an illustration here where there's a guy sleeping and there's purple arrows there. And usually you can imagine that there should be good airflow where those purple arrows go all the way down from the back of the throat and down into the lungs. But when you have a sleep apnea event, you have the tongue and soft palate. They relax during sleep, especially during deep REM sleep, and they get collapsible, blocking the airflow. And that's represented on that chart by those arrows abruptly coming to an end and not being able to go any further. So that's the essence of what obstructive sleep apnea is. And this, as that many of you know, can happen many, many times per night to the patient's detriment. Very prevalent, over 20 million Americans have moderate to severe obstructive sleep apnea. So very relevant topic for a disease that is very pervasive in the population. Next slide, please. And so the consequences of untreated sleep apnea, many of us are familiar with. It spans a number of different organ systems, but the endpoint is that you have decreased cognitive ability in many cases, fatigue, diminished productivity, more prone to car accidents, as you can see in that middle picture there. And then it can affect the sleep partner, as we call it, spousal arousal, and not in a good way. The other bed partner often ends up sleeping in a different room than the person with sleep apnea. And then finally, more serious things such as heart attack and stroke. So it can affect your heart and your brain health. Next slide, please. And so the frontline gold standard of therapy is CPAP, that stands for continuous positive airway pressure. And that acts as a pneumatic splint, keeping the airway open. Much like if you were to blow into a balloon, the neck of the balloon would stay open. And it's great when it works, but a lot of times it doesn't work. And so that's where the other treatment options come in. Next slide, please. And so I'm going to hand it over to Dr. Trott, because he's more familiar. He's our surgeon, and he's the expert in terms of the CPAP alternatives. And so go ahead, Dr. Trott.
Thanks, well, appreciate that. We see a lot of patients with sleep apnea, and sort of historically in the ENT world, we have not been really effectively able to treat patients simply with what we call anatomy altering surgery. But when patients fail CPAP or positive airway pressure, and there's a lot of ways to deliver this, as BiPAP and CPAP and different types of things that Shawna and Dr. Malish work with patients to try to solve before we get to the surgery line. First thing I recommend, if it's possible, and the sleep apnea is mild enough, is an oral appliance. And as you can see this demonstrated in the upper right-hand corner of this slide, kind of like two retainers stuck together, it pulls your jaw forward. And since your tongue is attached to your jaw, it pulls the tongue away from the back of the throat. That works reasonably well actually with people with mild sleep apnea, but most of the folks that I'm seeing are patients with moderate or severe sleep apnea. It's kind of like the mild and medium and hot way to measure the severity of the problem. And the worse the problem, the worse the potential for complications, and typically the worse the patients feel. And it's also harder to solve the problem. They may require more positive airway pressure. And when that fails, I'll say this, no one can actually, I think we can always solve patients' problems with enough pressure, but many patients can't tolerate. And I'd say typically about a third of patients who use CPAP, they put it on, they say, this is the best thing ever. I've had a great night's sleep, but my headache's gone. I feel fantastic. A third somehow struggle and get along with it. And about a third of the patients I see, they have sleep apnea, they know they have sleep apnea, and they just cannot use any kind of CPAP or positive airway pressure. So historically, the old way to do this was to use anatomy altering surgery, which is to remove the parts of the tongue or the tonsils. Interestingly, one would think that if you made a bigger space, it would work. But as you know, when you're awake, your airway's fine. I mean, no one has sleep apnea when they're awake. So this is sort of a dynamic process that occurs when people are sleeping, and just making a bigger hole doesn't really solve the problem, because it's really a complex dynamic process. When you're sleeping, you have more soft tissue collapse. And just by taking things out of the way, it doesn't necessarily work. Next slide. So when patients fail conservative therapy and they meet the other criteria, which we'll talk about, which is, I'll just mention it now, which is things like body mass index, which is a measure kind of height/weight of 35 or less, and they have moderate to severe sleep apnea, and they don't have too much of what's called central apnea, which means that your brain is not telling you to breathe. There are many patients that fit into the category where they just want to get rid of their CPAP or can't tolerate it, and they may be a candidate for Inspire. And I'll tell you, as a surgeon, having done now 40 of these operations, I try to talk most patients out of having an operation, and there's plenty that still want to have them. We don't want to take unnecessary risks. It's a pretty safe procedure. I've done it 40 times without any problems. Nonetheless, it is an implantable, essentially a pacemaker, and you can see this demonstrated on the left. That's what the device looks like. Essentially a battery with a little computer in it and a little two spots at the very top where wires go. One of those wires goes to a nerve that moves your tongue. The other wire goes as a sensor to determine when you're breathing. And this is off during the day. And then when you go to bed at night, we'll play the video here in a second, you can click on the device and turn it on. And then when you take a breath in, your tongue moves forward, unblocking the airway. We'll see if Matt can get the video to play. Here we go. So you can see there's a sensor, a breathing sensor depicted on the right side, sending information to the pacemaker. And you can see at the very top, the tongue moving forward with respiratory effort. So when people attempt to breathe in, that's when the tongue falls back. We're able to pace the tongue to move forward. This operation is done as an outpatient procedure. You can go to the next slide. It's done as an outpatient procedure. It's done through 2 incisions. One's about 1.5 inches long. The other one's just shy of 2 inches long. One's kind of over the mid portion of the chest on the side opposite where like a pacemaker for the heart would go. And there's an incision parallel to the jaw and the neck. Operation typically takes somewhere between 1 and 1.5 hours, and people go home the same day, except in extremely rare circumstances. Someone living very far from Jackson, for instance, if we're doing it later in the day, we may keep them overnight, but we're still considered outpatient. Most patients, it's sort of like a 70-30, 70% of patients don't need anything other than some Tylenol or ibuprofen. And there's about 30% of patients that may need a little bit of additional pain medication afterwards. The battery in the device lasts roughly 11 years, and changing the device battery part is very simple. It's a 15-minute procedure rather than an 1.5-hour procedure. And MRI compatibility is a question that's currently out there. It can currently be done for heads and extremities, including knees and ankles and hands, but sort of shoulders to hips are off limits. So at this point, pending FDA approval of this device actually being compatible in an MRI machine, you can't have an MRI of your shoulder or your heart. In the rare cases, those are needed. And I'll turn it over to Shawna. So I do the surgery, and we'll hold off on playing this for a second. Typically, people are seeing people like Dr. Malish first for a diagnosis and management of sleep apnea. And then when they fail conservative therapy, they typically see me. We talk about our options, and there's a multiple step approach. First, I see folks in the office, and then we typically set them up for something called a drug-induced sleep endoscopy, where we make sure the airways actually can be fixed. We want to make sure if we're going to do an operation, it's going to be successful. And then lastly, we do the operation. The operation, I mean, I did 2 last week. I've got 1 this Friday. They basically wait about 3 to 4 weeks, and then we can activate it. And that's where you go back to Shawna, unless she's out of town or breaks her ankle or knee, and then I take over for her in that case. Shawna, go for it.
Thank you, Dr. Trott. So if I am up and walking around and in the office, you'll come see me about 4 weeks after your surgery for implantation. And this is going to be the first time that we turn your device on. We activate it in the office, and there's a video here that just demonstrates how we do that with a programmer. It's nothing invasive. And we're looking at your initial comfort settings with Inspire. We're looking at tongue motion with stimulation to really tailor this to you so that it's comfortable, and we're seeing that effective tongue protrusion that we can send you home with to try using. We're also going to teach you how to use your remote at this visit so that you can turn your device on and off, which is really important, learning how to pause it. And you'll also learn how that you're going to step up your own therapy. So we established the range of voltage for the stimulation, and you're going to start really low, and you're going to gradually work your way up through higher levels of stimulation as you feel comfortable and as you feel tolerable to doing this. And so this appointment's pretty lengthy. We do a lot of detail, a lot of education, so that when you do go home, you feel comfortable and you're successful in starting out this. So if you want to play the video, Matt, I think it's pretty brief. And this is just the transducer. It's how we connect to essentially a tablet where we're going to program the initial settings. And then remote education. As you can see, the remote itself, it's really about the size of a computer mouse. It runs on 2 AAA batteries, so pretty easy. There's a video book we can provide you with as well. Send you home, you can watch some more videos in case you forget anything we talked about during that visit. So go ahead, you can go to the next slide. I think the biggest question I get asked is this effective? And clinical trials have done a lot of research and show that this is really something that is working for patients. If you just look at the graph, this is an average of what we call an apnea-hypopnea index, or an AHI. You can think about this as really the number of pauses or respiratory events per hour of sleep. And so the average before Inspire was 29.3. With Inspire, that was decreased dramatically to 6.2, which is 79% reduction. And so the answer is very successful when candidates are picked appropriately, which is why this is a bit of a process, and we do make sure that it's appropriate for people going into this. Next slide, please. Snoring is the thing I always get asked by the bed partner, and a big reason why a lot of people are in my office to begin with. But there's an 88% reduction in snoring reported by the bed partner when using Inspire. So both parties can win in this scenario. You can go ahead to the next slide. Patient satisfaction on Inspire is incredibly high. As Dr. Trott mentioned, with CPAP, we don't see anywhere near this type of patient satisfaction. I completely agree with him. There's about 30% of patients that no matter what we do or try or adjust, it just is something that doesn't work for them. They can't tolerate it for various reasons. So a 94% positive feedback compared to, you know, that 70-ish% with CPAP is incredible. We see this demonstrated as well with average usage of therapy. In the studies we looked at, the average usage was pretty close to 6 hours of therapy. And anyone who's been in that initial compliance period with CPAP knows we drill over and over that they have to get at least 4 hours. And that can be a really big struggle for a lot of people to even meet that insurance requirement of 4 hours. And so seeing that people are using Inspire for about 6 is also encouraging and just attests that it's working well for people. You can go to the next slide. The studies are there, the studies prove it. You know, that's what a lot of people ask me as well. There's over 100 peer-reviewed publications. There was a long-term 5-year STAR trial demonstrating long-term effects and efficacy of Inspire as well. There's an enrollment registry of over 5,000 patients. We're seeing this translated as it's adopted by insurance companies, even Medicare, and a lot of VA and other military hospitals are covering this procedure. Next slide as well. Dr. Trott briefly mentioned that there is specific criteria to meet the requirements to consider Inspire. And this is for good reason. You know, this is what was studied, it's appropriate for, and it works for these people. And so the first is you have to have a diagnosis of at least moderate or severe obstructive sleep apnea. We're looking for an apnea-hypopnea index, or those pauses in your breathing between 15 and 65 per hour of sleep. We also want to ensure that these events that you're having are primarily obstructive in nature. If we have too big of a central sleep apnea component, which is a little bit different, it's more of a neurological disconnect, Inspire can't treat that. So that wouldn't be appropriate for people with high amounts of central events. If you haven't had a sleep study within the past, it's usually about 2 or 3 years. We may need to do a new study. A lot of the times this is very appropriate to even just do as a home sleep test. So keep that in mind if your studies are pretty old. There just may be one study we got to look at first. Patients also have to demonstrate that they can't get consistent benefit or can't use CPAP for various reasons. I mean, obviously, if there is a less invasive alternative that's working for a patient, we really don't want to encourage them to go into surgery. We also need to have a BMI less than 35 for most insurances. And, you know, we see that obesity really can contribute to worsening sleep apnea and less effectiveness. So we want to make sure that that BMI is within the range that's accepted. The oral airway exam, Dr. Trott mentioned, is a brief procedure done outpatient in the endoscopy suite at St. John's, where he is looking at your airway through a scope while you're asleep under just a small amount of moderate sedation briefly to ensure your airway is collapsing in a manner that Inspire can treat. And then the last thing is patients have to be at least 22 years or older. Next slide. InspireSleep.com is a really great reference. Anyone who is interested in pursuing this further, I would really encourage you to explore this site. There's a lot on there as far as patient testimonials, the patient ambassador program, videos of how this works, really a good list of things if you're curious. Next slide. You can also call our office if this is something you really think you want to pursue or just have more questions and want to talk further about. Dr. Trott's office number is there, 307-739-7690. We'll probably put this back up as well at the end of the program so that you can write this down if you don't have that now. You can also visit our website, stjohns.health/InspireSleep for more information. Next slide, please. These are just some accolades about St. John's. You know, I'm very proud to work with this hospital, and we've earned a lot of awards. I think the care here is really so good. Dr. Trott really cares for all of his surgical patients and all of his patients in general, I should say. But if you're having surgery with him, you know, I have full confidence, personalized care. He'll give you his cell phone number if you need it. So you're not going to find that at a big university hospital. And also, you know, it's Jackson Hole, so it's a nice place to recover from a minor procedure. Next slide. The Inspire Sleep app, this is another useful tool. A lot of the things that are on the website you can also find on the app. This is just a little bit more user-friendly. If you want to download this onto your smartphone, it's the Inspire Sleep application. You can watch those videos here. I really encourage patients who are having surgery to definitely put this app on the phone. That way, when they go home the night after we activate it, they can basically go through what we discussed at the appointment again before bedtime, just to refresh their memory. Next slide, please. And I think from here, I'll hand it back over to Matt for our Q&A.
Great, thank you guys. So I'm going to leave up the number for the providers, as Shawna mentioned, while we do the Q&A here. So if anybody does have questions, right now is a very good time to ask them in the chat. So please feel free to go ahead and put your questions in there. Right now, the first question is, can you be a welder with Inspire? I know that with a pacemaker, you cannot. Do one of you guys want to try that, or I can answer as well?
Well, go ahead, man. I've had a lot of questions. The only thing that